Hello, future nurses. This is Nurse Ed Scholar. Today we're going to talk about fluid volume excess, also known as fluid overload. So we're going to talk about types, causes, and the assessment process. But before we begin, let's get a little background. So when we're thinking of fluid volume excess, it's when fluid intake or retention exceeds the body fluid's needs. So another name for fluid volume excess is also called fluid overload, or you may hear overhydration. Okay. Now, when we talk about the primary goal of treating fluid volume excess, we're looking to restore fluid balance, correct electrolyte imbalances, and address the underlying cause of the overload. So that would be by controlling or eliminating the cause. Okay. Now, there are, different types, and fluid volume excess isn't a one size fits all condition. Okay. Um, you have isotonic overhydration. So that's also known as hypervolemia, which results from an excess fluid in the extracellular fluid compartment. Now, only the extracellular fluid compartment is expanded, and fluid does not shift between the extracellular and the intracellular compartments. Isotonic overhydration causes circulatory overload and interstitial edema. When severe, or when it occurs in a client with poor cardiac function, they may have heart failure, and pulmonary edema can result. Hypertonic overhydration is rare, and an excess sodium intake causes it. Fluid is drawn from the intracellular compartment, and the extracellular fluid volume expands, and the intracellular fluid contracts. So, with hypertonic overhydration, fluid comes out of the cell and it goes into the extracellular fluid. And because fluid is coming out of the cell shrinks. Okay, it's rare, but it's caused by excessive sodium intake. And lastly, you have hypotonic overhydration. This is known as water intoxication. So the excessive fluid moves into the intracellular space, and all body fluid compartments expand. So the electrolyte imbalances that occur is a result of dilution. And one thing I do want to say, one thing that you'll hear is that when sodium is diluted, uh, it can cause an altered mental status and seizures. Okay, so that'd be hyponatremia. All right, so let's move on to causes. So, understanding, the causes of fluid volume excess is crucial. Uh, let's see, the causes of fluid volume excess. Now, causes of isotonic, so we're going back, isotonic overhydration, are caused by inadequately controlled IV therapy, kidney disease, and long-term corticosteroid therapy. So those who take steroids for a long period of time. causes of hypertonic overhydration is because of excessive sodium ingestion, a rapid infusion of hypertonic saline, and excessive sodium bicarb therapy. And causes of hypotonic overhydration would be early kidney disease, heart failure, syndrome of inappropriate antidiuretic hormone secretion, inadequately controlled IV therapy, replacement of isotonic fluid loss with hypotonic fluids, and irrigation of wounds and body cavities with hypotonic fluids. So you can hear how, hypotonic overhydration, you heard that word, by hypotonic fluids. They're using hypotonic fluids. They're trying to replace using hypotonic fluids. And that is how hypotonic overhydration occurs. All righty, let's move on. So how are we going to assess a patient? How are we going to spot a person in fluid volume excess? Now, we're going to go over each system, starting with cardiovascular system. So how are we going to assess fluid volume excess in the cardiovascular system? So we're going to be looking for bounding pulses, increased pulse, elevated blood pressure, distended neck veins and hand veins, elevated central venous pressure, and dysrhythmias. When you're assessing fluid volume excess in the respiratory system, you will assess for increased respiratory rate. Respirations will be shallow. The patient will exhibit dyspnea, and they'll have moist crackles on auscultation. Assessing fluid volume excess in the neuromuscular system, the nurse will assess for altered level of consciousness. So they'll have a mental status change, skeletal muscle weakness, headache, visual disturbances, and paresthesia. Assessing for fluid volume excess in the renal system, you'll be assessing for increased urine output if the kidneys can compensate, or decreased urine output if kidney damage is the cause. Excessive fluid volume excess, when you assess it in the integumentary system, you'll be looking for coolness of the skin, paleness, and pitting edema in dependent areas. Assessing in the gastrointestinal system, you as the nurse will be assessing for increased motility in the gastrointestinal tract. The patient may have diarrhea, increased body weight, liver enlargement, and ascites. And then finally, when we're assessing a patient with fluid volume excess, in laboratory findings, we would look and we'll find decreased serum osmolality, decreased hematocrit, decreased BUN level, decreased serum sodium level, and a decreased urine specific gravity. Okay, so that kind of sums up all of your assessments and your systems and what you'll be assessing for in fluid volume excess. Okay. So you as a nurse, we talked about assessment just now, and we're kind of reiterating it here. As nurses, our role is pivotal. We're going to be implementing effective interventions to prevent fluid overload, restore normal fluid balance, and administer diuretics as needed. Understand that we're going to be taking care of patients or clients with acute kidney injuries, chronic kidney injuries, and heart failure. And all of these patients are high risk for fluid volume excess. So just kind of talk about it again. What do we do for nursing interventions with patients that have fluid volume excess? We're going to administer diuretics. We're going to educate the patient on strict fluid volume intake. We're going to monitor intake and output. We're going to monitor weight, and we're going to monitor electrolyte values and prepare to administer treatment to treat an imbalance if present. All righty. So that sums it up. Thank you for watching Nurse Ed Scholar. Please click like and subscribe. So to all y'all aspiring healthcare heroes, happy learning.